Thank you to our witnesses for being here today. Thank you, Senator Carper, for the line of questioning you just had. I would also say that if we can partner with families like mine, which have been dealing with children who are now adults with complex medical conditions at home for an entire generation, there's a lot of creativity and innovation to be had. And I would really look forward in working with these witnesses and all of my colleagues on improving things like hospital at home and implementing them. But I did want to start with a more specific question to you, Ms. Stein. Senators Duckworth, Blackburn, Casey, and I recently urged the Centers for Medicare and Medicaid Services to conduct a comprehensive review of its coverage of mobility assistive equipment, such as wheelchairs, canes, and scooters. CMS currently has a really narrow interpretation of what equipment should be covered and when. We are just talking about, silos and specificity and reference back to very outdated models. Medicare right now covers equipment for daily activities within the home, but many people also need equipment that's more appropriate for use outside of the home. We're asking CMS to reassess this standard to ensure that individuals with disabilities can get the support that they need to live independently and to participate in their communities. So, Ms. Stein, can you speak to how Medicare's limited coverage of mobility equipment impacts patients and their families, as well as the implications it has for individuals' participation in their communities?
Absolutely. Thank you for the question. And I think this is a place where both Congress and CMS need to revise outdated law and policies. As you know, it is said in order to get Medicare coverage for most equipment, prosthetics and orthotics, they need to be primarily for medical reasons and primarily used in the home. And by the way, the home can't be your SNF, your nursing home. Right. Those things can be changed by, the definition of home needs to be changed by Congress. But the use in the community is incredibly important. And an example of where what we thought were the horizons for people with disabilities have fortunately been expanded. Yeah. So we don't want, nor do people with various disabilities need to remain in home with their equipment. And in 2023, the equipment can often allow them to exit home, to work, to be with family, whether it's mobility devices, whether it's technology so that they can speak, right, which Congress fortunately covered a few years ago under Medicare. These things definitely need to be looked at as CMS has authority under its current mantle to define the medical use and the value of this equipment, where and when it can be used. They should push the envelope with regard to the use of this equipment and standardize equipment so that people can use it given their particular disabilities. And then legislation would be helpful to expand the notion of what's primarily medical use, yep, and to be able to be used in the community.
Well, thank you very much for that input.
I hope that's helpful.
That is helpful. Thank you.
And if we can help you from the Center for Medicare Advocacy, we would greatly like to offer our legal acumen and stories from our clients. This is a very important area.
Thank you very much. We will follow up with you on that. Mr. Dombey, I wanted to ask you a question. As you know, the Centers for Medicare and Medicaid Services is currently working to finalize a payment rule for Medicaid home health services. This rule includes important updates to the Medicaid home care benefit to preserve the quality and safety of home health care. It would require that home health organizations direct 80% of their Medicaid payments towards workers' wages. So I strongly support fair wages for essential workers such as home health aides, but I'm concerned that this requirement may have really unintended consequences. New Hampshire has an unemployment rate right now just under 2%. It's the lowest in the country. Home health organizations face significant vacancies for positions and competition for workers. The requirements outlined in CMS's recent proposed rule would require a level of staffing that simply may not be available in the short term. So can you speak to these workforce challenges and the potential impact of this rule on access to home health care?
I mean, we as an organization have long supported better compensation to the caregiving workforce. And I think the proposed rule has that intention. It's just not a good execution on the intention that's there. We have analyzed multiple states and whether or not their systems would lead to positive or negative outcomes as a result of it. You know, that 20% that's there goes towards such things as supervision, training of the aide, as well as the day-to-day business stuff of building the Medicaid program on that. So we don't find a single state that could meet that standard. And if they can't meet that standard, what happens with the program is the consumer of the services is on the outside looking in. Right. So we'd certainly like to work with you, work with the White House, and work with CMS to come up with better approaches to achieve the same end. I know Senator Casey, one of your colleagues, has also been very actively involved in this issue, and so I think there's a, so long as there's a will, there's a way, and I think we need to take a different path, but we can get there.
Thank you very much for that, and I thank you for the indulgence, Mr. Chair. I have one more question that I'll submit for the record to Dr. Moroz about the waiting lists, and I appreciate very much this hearing. Thank you.
Thank you, Senator Hassan, and let me thank all of our witnesses